Hi guys, it's Pierre, the physical therapist, and a lot of us haven't been getting out to the gym. We haven't been getting outside as much, but the weather's starting to break. So we're going to get out and try to get moving, whether it's walking or jogging. Whatever it is you're going to do, I just ask that you be responsible about it. I know that you've heard me say movement is important, but let's be responsible when we're getting back into movement because we haven't been doing these activities in a while, and we might not be in the same shape as we were when we last were doing those activities. So start off at a lower intensity or volume. So if I usually run 5 miles, I'm not going to go back and run 5 miles. And I'm definitely not going to run at the same pace as I used to. But I know what you're thinking. Hey Pierre, where was this advice last week? Because we already had one good weekend here. And I got out and I overdid it. So I want you to take stock as far as what does overdo it mean to you? Are you just having some muscle soreness? Well, that's okay. Let that inflammatory process run its course. Get back into doing what you were doing, but maybe start at a little lower level. Calm stuff down before you build it up. But if you're saying, hey Pierre, I overdid it and I'm having pain, whether that's back pain, knee pain, hip pain, whatever that pain is, then that's a different story. So I want you to consider, if you're someone who's worked with me, that's that flare-up I was talking about. Dust off that homework sheet I gave you, get back into doing that homework every 2 hours, back down to twice a day, back down to nothing. So if you're going back to doing your homework, or if you're someone who hasn't worked with me and don't have homework to do, but you've gonna just let it have some time, you've waited a week or two and that pain isn't changing, well then that's an issue there, because pain and weakness are alarms in your body telling you something's wrong. So if you start to ignore that alarm, or you let that alarm go on too long, that alarm may get louder for some people. So that's when I suggest that you come in, let's take a look at it, let's recheck your homework. Let's go over and do a thorough evaluation, see what are the things that bother you. Tell me your story as far as what you were doing to flare yourself up, so we can figure out an exercise for you to do to help you manage these symptoms yourself. Movement is so important. How are we gonna turn off that alarm? We're gonna turn it off with movement. Which movement's right for you? I don't know that without knowing you and your story. So when you come in, we'll figure it out, see what things bother you, try an exercise, come back and recheck and see if we made a difference. MDT is a great way to figure out what movement's right for you. So move effectively, move efficiently. Have a great day.